Your partner, would that be helpful?
No, that's okay.
All right. So disc disease is one of the possibilities. Another possibility is what's called degenerative myelopathy. Have you heard of this?
No.
Okay. So degenerative myelopathy is a disease process where the tissues that essentially surround the spinal cord and the nerves that provide insulation to the spinal cord and the nerves and allow the appropriate signals to go down.
Is that kind of like multiple sclerosis in a human?
Kind of like,
Okay.
yes. Yep.
All right.
Mm-hmm. This degenerates over time. And it's something that can be a chronic progressive disease where we initially start to see it affect the back legs, and over a period of time, usually 6 months to a year, it progresses to the back legs not being completely paralyzed, and then progresses up to the front legs starting to be affected, starts to affect the dog's ability to breathe, and unfortunately there are no treatment options for this disease. I'm going to go into how we kind of investigate these diseases, but that's that disease. Very common in German Shepherds, Corgis, Boxers, but Cavaliers also can be affected by this disease. Other things that we can think of are inflammatory diseases where the immune system attacks the the spinal cord and the tissues surrounding the spinal cord. I think that's less likely in his scenario because typically those are a little bit more younger to middle-aged dogs, but technically possible. Other things that we can see are cancerous lesions that can be a slow-growing tumor that can affect the spinal cord as it grows. So these are kind of the main things that we think of. Lastly, there are some abnormalities where they can get cystic structures, like a pocket of fluid that can accumulate in the spinal cord as well. Again, those dogs tend to be younger, but we can see them in older dogs as well. So in order to kind of investigate these things, the degenerative myelopathy, coming back to that, there is a blood test that looks for whether or not the dog has the genes associated with the disease. If they have, there's kind of 3 different options. They can have I don't know if you remember genetics at all in high school, but they can have 2 copies of the gene, they can have 1 copy of the gene, or they can have no copies of the gene, X being the gene in my diagram here. Patients who are carriers are typically not affected, and patients who don't have the gene are typically not affected. Patients who have 2 of the genes, if they test positive for having both genes, it does not necessarily mean that they have degenerative myelopathy, but it does mean that they are far more at risk of having that disease. So the other way to rule it, to state whether or not it's degenerative myelopathy, is to rule out the other diseases. Now, that being said, he could also have
a combination.
Yeah. So even if I do an MRI and I see disc disease, if we do the degenerative myelopathy test and he has both genes, I'd be really hesitant to do anything about that disc disease surgically, because you can actually, in patients who have degenerative myelopathy, if you cut them and do surgery, you can actually make them a lot worse. So this test is, for him, I think, important for our plan moving forward.
What is the treatment for that?
Unfortunately, there is no treatment for degenerative myelopathy, yeah. But if he doesn't have evidence of carrying the gene, or even if he's just a carrier, technically carriers can develop the disease as well, but it's incredibly rare. But if he doesn't, then I think considering an MRI as the next step and investigating these other causes and seeing if we could do something with these other causes I'd be far more inclined to move in that direction if I know that this, depending on what the results of this test are. Does that make sense? Because I would hate to do those things and he has multiple things that are, would make surgery in him or something like that, make it worse for him. So, like I said, to rule out other diseases, we have to do MRI. MRI requires general anesthesia, and so that's going to kind of circle back to the fact that he has quite a significant heart murmur. So in addition to doing the blood test today for the degenerative myelopathy, I'd like to get an echocardiogram, which is an ultrasound of the heart, to see if he needs to be on any medications or anything like that that would be beneficial to him long-term in general, and to get cardiology's opinion on whether or not he would be a good anesthetic candidate. The cost of the echo today would probably be, with the full consult and doing x-rays of his chest, would probably be about $400 to $600. That would be the ultrasound of the heart, the chest x-rays, and their consultation. The blood test, I believe, is probably about $200. The other thing is, a lot of these diseases, the fact that he can walk is good, particularly with disc disease. And so if he has disc disease, another thing that we could consider is doing medical management, which sounds like he's already been on, but I'd like to do some blood work to make sure that the medical management that he's been on is safe for his kidneys and everything like that. So that's more like systemic blood work. So the other thing to mention is in his neck, he does have quite a bit of neck pain. And we can see disc disease in the neck, we can see inflammatory disease in the neck, we can see cancer, we can see cysts. But in Cavaliers, by far, the most common thing that we see is a syringomyelia. And I know you're familiar with this term because you've already talked about it with the last place that you went to. And the syringomyelia can actually develop, it's most commonly develops in the neck in Cavaliers, but you can also see it in the back. So that's another thing that could be added here to his list. But again, I don't think it's his primary problem. So the syringomyelia can be in either location. And typically it can be associated with pain. So when I palpate his neck and he reacts, any of these honestly could be associated with pain, so it doesn't really differentiate that. But it's by far one of the most common things that we see in Cavaliers. 95% of them have a malformation of the skull, about 70% of them develop syrinxes, and about 50% of those patients are clinical for it. So it's very, 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 very common. And so I think that he probably has one of these 5 things going on in his neck, but like I said, I think his back is the primary problem.
Now, how do you I can't tell if he's in pain.
Yeah.
I mean, so when you say he's got significant pain in his neck,
it's when I push on his neck that he yelps out.
Oh.
But I think he's moving around his neck around the room, looking around okay. Does he ever phantom scratch, like where he, or air guitar scratches? Have you ever heard of that?
No, but he will every now and then scratch behind his ear, but okay. I mean, he's actually scratching something, so I just figure it's a flea or something.
Sure. Does he ever take his head and rub his whole body on the floor?
Yeah.
Okay. So those are kind of some common things that can happen. And honestly, a lot of dogs do well with just medical management of that, which is gabapentin. There are some other medical management options that we have as well. There are some dogs that don't respond to medical treatment. But I think that his neck is probably his secondary issue and his back is his primary issue.
Now, what causes, he's very restless at times.
Yeah, it may be pain and discomfort. And I do think he's, in his back, I don't know if you've noticed, he's kind of arched in his back. And so that can be also related to this stuff as well.
Okay.
So does all of this make sense? So the possible things that could be going on in his back, kind of the plan moving forward today, I'd like to summarize, to do the blood test to look for degenerative myelopathy, to then also get an ultrasound of his heart, to do blood work to make sure that we are okay on the medications that we're currently on, and pending what these results are, the blood test for the degenerative myelopathy, I'm not going to get back for another week. Depending on what these tests show, make a decision about moving forward to further investigate the rest of these causes with an MRI.
Okay.
To just make sure that before we jump to an MRI, that is in his best interest.
But we can actually see the ultrasound and the x-rays today.
Yep.
Because I'm really curious to see, and now when I forward the stuff to you from the prior MRI and x-rays, I'd like to compare the two to see where they found something before.
Yeah.
And if it's in the same spot, if it's gotten worse, if it's in another location.
Yeah.
I mean, I think that would be helpful.
No, I think that would be helpful too. I will tell you that the x-rays are going to be of his chest, and that x-rays of his spine is probably not going to be very informative. And we won't, because you can't see the spinal cord, and really all of these diseases we're primarily looking at the spinal cord. So we can't evaluate that on X-ray, which is why the MRI would be the better diagnostic. But I think his chest X-rays in terms of his cardiac disease would be beneficial. And if we move forward with an MRI, it definitely would be helpful to compare, and it would be definitely helpful to have.
Can we do an X-ray the same as the one that we did back 8 years ago?
Of his neck? Is that what you're
asking?
Well,
I think it's of his whole thing, but I'll send it to you so you can see.
Yeah.
But what I would really like to do is to get one exactly the same to see the difference between the two.
I mean, we can do X-ray of his spine. There are some types of cancer that we can see on that. There are some types of disc disease. But again, it's not going to be able to show me a majority of these things. So, yes, I can do it. My hesitation in doing it is that for the X-ray of his chest, I don't have to sedate him. For the X-ray of his spine, I do.
Oh.
And with his cardiac disease, sedation isn't. I would try and avoid it if you could, to try and prevent any complications. So I just think that the benefit. I get where you're coming from, but I'm concerned about the value of the information we're going to get for X-rays with the risk of sedating him with his cardiac disease may not really be worth it.
Okay, I thought that if you had to get an X-ray of the chest, it's the same as the
makes
back.
Makes total sense. I can see why you'd think that, and so it's just that for the spinal X-ray they have to be perfectly still, whereas the chest X-ray they don't really have to be. In fact, we want them breathing pretty well during the chest X-ray, so it's just that I have to sedate him for the spinal X-rays, which I can do. I just for the amount of information we're going to get out of them, which is probably going to be pretty minimal, with the risk of sedating him with heart disease, I feel like the balance there is probably, leaning towards not doing them. But if you would like to do them, we can.
Okay. All right.
What are your thoughts on that?